Sometimes there are truths you know, but you cannot talk about. There are many conversations young people are having in hushed tones and cannot bring to the public. Well, someday you must face the reality of the situation and speak out. We present Loud Whispers. Loud Whispers. A radio drama that takes you on a journey of reality as we explore social issues, reproductive health, and right matters that are often discussed in whispers. Experience 15 minutes of intrigues, humor, and suspense-filled radio drama for 18 weeks.
Join us every Friday on 32 FM 94.9 from 7:45 p.m. to 8 p.m. from June 2020.
Loud Whispers is proudly brought to you by One Life Initiative with support from Amplify Change.
Okay, it's a very good evening right here, and I'd like to say a warm welcome to you as we take on the second season of the radio interview of the radio drama review, Loud Whispers, also known as Igbe Kele Kele. All right, it's a good evening. I am Oluwatoyin Fashaluju, and of course I'm not alone here. I've got my guest as usual. Yes, you just listened to one of the episodes, yes, of Loud Whispers right here on 32 FM 94.9. Today, the 20th day in the month of August 2020, and of course it's going to be a beautiful moment in the radio in the studios this evening. Okay, so I'd like to say a warm welcome as well to my guests and my co-hosts this evening. I'm talking about the Executive Director, One Life Initiative. I have him in the studio this evening, and his name is Shola Fagurusi. Good evening, and good to have you.
Same here. Good evening, and again, I'm excited to be here. I'm looking forward to this conversation.
Okay, it's going to be interesting. And also, I've got on my right-hand side this evening, and she's Sister Tamila Omojola. Good to have you in the studios with me this evening.
So I'm happy to be here. So thank you for.
You can see they are blushing. Oh, you know that see the way they are blushing. You're smiling. Yes, they feel. Yes, this is a studio that is filled with laughter. You know, each time you are here, even when you're not happy, you tend to be happy. We fill the world with laughter. So don't be surprised if they are just smiling and laughing. And you know, we have the vaccine here. All right. So also, I've got the crew, the media man, of course. That's Mr. Femi Akonde. Well done. And of course, he's saying shout out to you, listener. Also, the Monitor and Evaluation Officer, One Life Initiative. She's right here in the studio. She's here to monitor, to know what's happening. She's fully grounded. Kajad. And of course, I'm talking about Moyi Ishola. Good to have you around monitoring us. Good evening. And she's saying hi too. All right. So, well, once again, I say welcome in case you just tuned in. Of course, this is One Life Initiative for Human Development Program. And of course, this program has been on for a while. And I know you're ready for us this evening, this night, as we are ready for you in full. Okay? So, as I have them as my guests this evening, we'll be discussing so much about SRHR. Yes. And of course, we'll be talking about One Life Initiative for Human Development. And maybe we should just start with that. Tell us a little bit, and I'm talking about the director.
Okay, so this is not a convenient conversation. You know, so many parents like to have. Okay. You were trying to mention SRHR there, which is an acronym for Sexual and Reproductive Health and Rights. The way our society is structured is that you have parents as the first agents of socialization. They engage their young ones with morals. Tell them this is what you need to do. This is how to behave. But we also get to see that education education is not complete on its own.
Okay.
So this, young people, adolescent, teenagers, young adults get into school, secondary school precisely, and then you begin to also see certain kinds of conversations. The teacher would basically give them information about how to go about their academic lives. But one major gap we continue to see, which if not addressed and when not addressed, actually leads at times to deaths, actually leads at times to several other unintended consequences, is that gap of not providing comprehensive sexuality education, which is primarily what attending to issues of sexual and reproductive health and rights of young people basically are. What are your reproductive rights? What are those sexual matters, for example, they want answers to? So the young person, for example, starts menstruating if it's a girl. So who is she going to run to get answers? You're young, you are 16, you wake up in the morning and then the entire bed is wet. You didn't be overnight, but that's wet dream basically. Who will this young person run to in terms of getting information? So the girl begins to have butterfly in her tummy and she's just 18 or she's just 15. Some of them at times even just 14, right? Who do they run to?
Even 10.
Ask, who do they run to ask, ask questions from and get answers from? So these are some of the, hard conversations that, we're trying to get into the space to say, look, let's have this conversation with young people. Let's provide this information to young people in a non-judgmental way that makes them very comfortable. That makes them, willing to actually open up and further ask other questions. And so that's what, this is about.
All right. Interesting. He has said so much about that. Of course, you can feel free to talk at any time. You have anything to say, you can feel free. In case you don't want to talk to mommy or daddy, they are there to talk to you. All right. And they are there for you. And you can be assured that there won't be any butterflies left in your tummies. All right. So I want us to talk about the radio drama. So talking about the radio drama, what is the radio drama tending towards, and what do you want to achieve with the radio drama?
All right, so quite a number of issues are addressed in the radio drama. This is loud whispers, Yoruba called Ibekele. Now, the idea behind that phrase itself is the fact that so many young people have whispers. So many young people have things that are, rumbling, thoughts rumbling in their stomach that they really cannot voice out. When they actually try to, some of them go to Google for answers. Some of them go to their peers that are also sometimes not as informed, who are also sometimes uninformed, just like themselves. So loud whispers basically encapsulate all of these growing concerns. What do you do, for example, to actually stick to abstinence? Abstinence is still a value that we're beginning to see so many people actually push back strongly against. What do you do, for example, when a young person is already sexually active? Due to basically due to the young person's socialization. What happens when a young person also runs into unintended pregnancy, runs into a case like that? And these are realities that we see daily. What happens when a young person has a sexually transmitted infection? If you have sex unprotected, there are also consequences that will be very glaring. What happens when a young person, for example, has HIV/AIDS? What are those new innovations, for example, in public health? What are those burdens around unsafe abortion that we are also beginning to see? So Loud Whispers is about looking at all the issues, as many as we were able to bring together with the help of the directing team, right? We're able to bring them together in 18 episodes. And thankfully, you were also in the studio. You saw how it went. You saw all our conversation, the argument. Is this the right way to say this? Is this a slang that young people use? For example, when they exclaim, they say "Mado," right?
Mado.
Right? So we have to look at all of that to say, look, how do we make this interesting in a way that young people in 15 minutes every week for 18 weeks, we're sure that they are getting some level of information that their parents may not be comfortable giving with to them at all. And one of the things we also like to say is that, look, we've had parents push back and say, look, oh, you're talking about sexuality education. We don't think you should give to this 15-year-old. And we always say, look, your children would go into places that you will not be with them, right? You want to give them information that helps them make informed decisions later on in life. And at times as well, that information may not be for them. It may be for their friends. So if your child, for example, holds the value of abstinence very strongly, fantastic. You've done your job pretty well as a parent. What about that other child that will be the roommate, to your friend, to your own daughter? What about that child that will be the roommate to your own son? Do you think that child also deserves to die simply because he or she is not as lucky as your own child in terms of obtaining or taking other friendly reproductive health information? So that's what Loud Loud Whispers actually, seeks to do, and the idea behind this conversation again, coming in every 6 weeks, is to say, look, what are those questions that people who have followed the radio drama have? If there are questions you want to ask, you want to reach us off air, you don't want to talk about this, you are assured of confidentiality, and then we can look at those issues. If we don't have answers, we'll link you up to platforms where you can also get answers.
All right, and in case you just joined us, this is 32 FM 94.9. Here we'll fill the world with laughter. And of course, the program is sponsored. This program you're listening to is sponsored by One Life Initiative for Human Development with support from Amplify Change. And of course, the program is done as part of Sexual and Reproductive Health and Rights Project, aimed at accelerating the abandonment of unsafe abortion in Nigeria. All right, so you want to call, probably you need to get in touch with One Life Initiative after the program. Okay, I've got phone line for you, so get a pen and paper so you can write down the number. The number to call 0902 777 0177. That's the number to call. So probably after the show, you call, you have something to say, you have questions, you have so many unanswered questions. Yes, you can direct it to the person that will pick the your call as it comes. All right. And of course, just as I said, the program is sponsored by One Life Initiative and proudly supported by Amplify Change. Okay, so I'll be going into the questions proper now, and I'd like to turn to my right now to ask Sister Tamilore Omojola this question. What are the reproductive health issues portrayed in the last 6 episodes of the drama?
Okay, so if you have been following the drama closely or you've been listening every week, you will notice the character of Tofumi, Risikat, Bolu. They have all had sexual and reproductive rights issues, and some of them include unplanned pregnancy, female genital mutilation, rape, GBV. Also, we've seen cases of unsafe abortion and the use of contraceptives. Most of these issues are issues that young people face, and they do not have anybody to talk to about them, because they either feel shy or they feel like if they talk about it, the older ones will probably shun them and say, why are you even discussing this at this time? But then a lot of young people need comprehensive sexuality education as early as possible in order for them to be able to navigate childhood properly, adulthood properly when they grow.
Okay, so I'll tilt to Mr. Shola. I'd like to ask, based on the drama, looking at the comprehensive sexuality education session at Bolu's school, do you think this should be adopted across all secondary schools as they house majority of the adolescents in the nation?
Okay, so we have what is termed, age appropriate information when it comes to sexuality education.
Okay.
So what you tell, a 5-year-old is absolutely different from what you tell a 10-year-old. It's different from what you tell a 15-year-old. So, for example, when we go into some of those, secondary schools, we don't talk about, condom use, right? We don't bring that to the table. One of the things we majorly would put on the table, we talk about abstinence, we talk about menstrual hygiene, we talk about body image, we talk about self-esteem, we talk about STIs, we talk about HIV/AIDS, we talk about issues of female genital mutilation, we talk about the various reproductive rights that also exist, right? But however, the approach that we have seen that works, and this is also information for several people who also program for young people. Whatever it is you do when it comes to young people is the fact that, look, they always would approach you and say, oh, something happened to my friend, this is the issue with my friend. So they always want to put it in that third person approach, and won't come to you and say, this is exactly my story. So we allow them use an anonymous question box. So we just distribute papers to them and ask them to write. If you want to change your handwriting, feel free to actually go ahead and change your handwriting, and then drop it in the box. So that way we begin to read questions, and we've been shocked at the kind of questions we have seen in quite a number of secondary schools that we have, actually, had to visit. Young people, mentioning the fact that, they have relatives, for example, who are engaging in sexual intercourse with them and are looking for a way out of this. We've had cases, for example, young people asking what is the right time to start engaging in sexual intercourse. So again, these are hormones, right? Raging. You can't suppress them in that sense. But if you put all the information on the table and you let them understand, for example, what the consequences are, then we may begin to talk about a clear solution. So our recommendation really is that yes, it's important that young people have this information. Young people should understand, how to calculate their menstrual, cycle. They should know how to take care of themselves during, their menstrual, during their period as well. Young people should understand some of the burdens that actually comes with, mood swings that actually comes with you being an adolescent. They should understand, several issues. It also comes with careers as well. So again, when we talk about sexuality education, most people also think that, it just stays at that. But when you start talking about, goal setting, for example, when you start talking about body image, self-esteem, there are young people, for example, who will tell you, because my breast size is smaller than that of my colleague, or because I feel that people have told me my friend is more beautiful than I am, and because of that, they begin to feel very bad. So how do you help them see that, look, that's not the shade in which, life is actually made of, so that's what this is really about, to make sure that at the end of the day, what the parents are giving to them, when they do, the guidance are given to them, what the school is providing, together with the information they are getting around reproductive health, makes a whole, such that they grow up to actually be very responsible adults.
Obviously, with all what you've said, yes, we'll go on a break, but before that break, obviously, with all what you've said, it shows that you've gathered some experiences with a couple of time, and I'd like you to probably tell us a little about your experiences with this adolescents, and what you think can be done to help them better.
Okay, so on this project, for example, we just did a tour of some local government, in the Okogun axis, and also Ibadan as well. We're working in about 10 local governments around, and we're seeing patterns, we're seeing trends, we're seeing things that are shocking in those communities. We've seen fathers, for example, who impregnated their daughter. We still had that case last week. We've seen, it was a girl who was going to write, an exam, the same, West African Examination Council senior secondary school certificate examination just last week. We've seen cases of young people saying they use about 21 sachet of an analgesic just to actually end a pregnancy. We've seen young people, for example, show complete ignorance about their menstrual cycle. We've seen young people, for example, take on lifestyle, for example, that you would be shocked at and say, where did you get this information from? We've seen quite a number of myths also around abstinence, and this is one of the things we keep pushing on the table, that look, it is still fashionable as a young person to abstain, right? You don't need to worry yourself about unplanned pregnancy or unintended pregnancy. You don't need to worry yourself about STIs. We have also seen, so our model, for example, we had a case where we were told that, look, you get pregnant and you want to end the pregnancy, you just need to get butter, you grind it, and then you take it in, right? So our approach really is that we've embedded individuals in communities who are also trained. We use the local language. We bring them together for about 6 weeks, and then we run them through this same module that I just mentioned, and they also listen to the radio drama. We get feedback from them, they understand, and they become referral agents of sorts in the community. So when the friend has problem, they're able to say, look, let me take you to an auntie in the community who would likely provide your answer. Oh, your friend, your other friend here is having this particular issue. You don't need to sweat it. There's someone who has an answer for you. And if they don't have an answer, they come back to us. And if we don't have an answer, we also have linkages where we can actually call, support system that we can reach out to and then bring the answers to the table.
All right, you are listening to 32 FM 94.9. We'll go on a break. When we return, we have a lot of questions. And of course, I know you are enjoying the time this evening on radio. So keep your dialogue right here, 94.9.
32 FM
94.9.
Kasala don't post. Hey, my own don't meet me today, and I wanna make. I wanna, but he say no yawa without rubber. He lie. Me sef come mumu join. We don't even remember Bele at all. Now Bele don't land for my domot. Who I want tell? What I want tell my mama? Try, mama can you go kill me today?
Not the only condom you fit use prevent belena, even if yawa boss. Solution fit day. No go put yourself for big girl. No go wound your body. No go kill yourself. For more information, Tori, call 0902 777 0177 quick. Make we yarn with you one-on-one. This message now from One Life Initiative with Collaborate from Amplify Change.
Stay tuned to 32 FM 94.9.
All right, you're welcome back. Yes, in case you just tuned in, welcome. It's One Life Initiative radio interview and talking about SRHR, which of course is sexual reproductive health related issues. Okay. All right, and of course I'll be moving to the question that I'll be asking Tamilore right now, and we're talking about the drama. We saw that the herbs Diola got for family planning failed her. What is your view about trying to avoid use of modern contraceptives? And looking at the situation Diola was in, what is your view about her decision?
Okay, so some of the issues that make people feel modern contraceptives are not to be used or they're not good are the myths surrounding contraceptive use. So some of the myths include the fact that people think when you use contraceptives, you get fatter, or when you use contraceptives, you bleed excessively, or also when you use contraceptives, people who use contraceptives are people who are not faithful to their partners. But most of these myths, or all of them, are not true.
Some will even say you won't get pregnant again later in life when you want. Or some will tell you that your liver will be damaged and all that.
Yeah, so those are myths about contraceptives.
Okay.
But the fact is, the use of contraceptives basically helps women to space childbirth.
Okay.
So a woman gives birth now, and in 3 months she's probably pregnant again. Her body has not even healed from the previous delivery process that happened to her. She has to heal to be able to conceive another child and give birth to the child properly. And this also leads me to the question where you asked about the decision Diola took in the radio drama. So as a woman, we were created differently. So we have a lot of different body processes that goes on in our body, and basically some of part of our sexual rights is the right to privacy, to liberty, to body autonomy. So we have our body, and as we can see from that drama, Diola chose what was best for her because she felt she needed to preserve her life rather than die from childbirth.
Okay.
So let me try to describe her situation. So she gave birth, like she had a 3-month-old child, and she was pregnant again.
Okay.
And previously, when she had the child, the doctor already told her to hold on a bit before giving birth to before conceiving another child. So she was pregnant again, and she was so confused. She didn't even know what to do, and she had to make a very hard decision for herself.
Yalagbo.
Yeah, she had to go to Yalagbo, then also go to the healthcare provider. So basically, for women, we have the right to decide what happens with our bodies, and even while doing this, to be very important to also visit very informed professionals who are medical doctors in the hospitals, who will help to provide the right information on how to go about things and how to do it properly. So our decision was based on the right information she got.
Okay, so Mr. Shola, I would like to ask you, can you tell us what the law, I want you to shed light on what the law says about issues related to abortion, and what the law says about, and what the statistics look like as well, and your realities and findings on these reproductive health and rights issues since the project had started.
Okay, so again, the legal instrument actually defines this. So here in the southern part of the country, we rely on what is called the Criminal Code of Conduct.
Okay.
I think section 228, 229, 230 speaks to, some of these issues that, you just mentioned. So the law, speaks, for example, that you only get to actually, a woman can only procure an abortion when it actually impairs on her health, when her health is at risk. And then, the World Health Organization describes, health as a complete state of physical, mental, and emotional well-being, right? So it means that you have to look at those, 3 areas. But again, the law in another breath again also speaks to the fact that, so if you procure, for example, what the law calls miscarriage, if you are, the provider, you are liable to 14 years imprisonment. If you are, the woman herself, you have 7 years imprisonment. The person who supplies whatever tool that is used also has a share of, I think, about 2 or 3 years, of imprisonment as well. So there are 2 ends to this. So the woman who has procured, and of course the healthcare provider. So the question is, who gets to report this? So what the statistics also show is, pretty far from this. So Nigeria has, one of the highest maternal mortality burden, and one of the things we have seen very clearly is that the figures, feed in from what we see in terms of consequences of unsafe abortion. So there are data out there showing that about 500,000 of such are captured in the country. The ones that are captured, in the country every year, right?
Yeah, we can hear
now, apart from this as well, we also need to understand what happens, at the back, at the back end. So if you go into suburban, rural, even some of, the urban poor communities, one of the things you see is that a community health extension worker, an apprentice nurse, for example, is designated as a medical doctor. Right, so there are people who actually go to these locations to actually procure service. So my point really is that the reality in terms of what the law says versus what is really happening on the field is really far. We sometimes last year we were part of a study. We had gathered I think 45 girls under the age of 19, and 44 of them knew various methods of unsafe abortion. Right, which again speaks to what basically happens in the community. If you ask people to mention and say, have you had someone who had this experience, you would always have someone who will say, I know someone, I have seen someone. Right, so again, it's about, I know the Federal Ministry of Health, has, some form of documentation around, what's the protocol, what should be done, and all of that. And so that's why we're saying that, look, this has to be given a holistic approach. How do we bring abstinence on the table? And our experience on the field, again, is that nobody is giving those kind of information in heavy doses to young people, right? Nobody, for example, is trying to reinforce the fact that, look, abstinence is something that you should uptake, and these are the things you need to do. Nobody is, giving them information to say, look, when you do A, B, C, and D, when you take alcohol, for example, and then you try to engage in sexual intercourse, like we saw in the case of, I think that was, Wale, right? Your decision is impaired. You are not going to be able to make, sound decision. And that's exactly what we actually, see happen in some of these, rural communities. You still have instances of rape. So how many people, for example, have information that, when this happens, if you're trying to also take care of the health of, the survivor, you need to actually get it, get to the police station, get a report, get to the hospital, and get an emergency contraceptive. After that, get what is called a post-exposure prophylaxis to make sure the person doesn't have HIV/AIDS, and at the same time the person also doesn't end, being pregnant. So these are realities that we have seen in communities based on what we've been doing and our work so far.
Okay, so interesting. Before we'll proceed on another break, I'd like to let us know that I've got questions. We've got questions here that we'll be asking the listener at home, and those that have been following the trend of the drama, the radio drama. I've got interesting questions for you. And of course, we won't just ask you questions without rewarding you. Yes, we want to reward loyalty. We want to reward the fact that you listen to the show every, well, let me not say when again, so that when I ask you that question, I will be giving you a review. Yes, so Sister Tamilora here will be asking us some of the questions. That's for you, the listener. So you would open our lines for you to call, and of course we've got 2 phone lines here: 0809 7000 949 and 0906 2000 949. Those are the numbers you're to call to ask whatever question you want to ask us this evening. Yeah, probably you want to know more, or you have some questions inside of you that you really want to ask, or you want to say, or just something. You have two phone lines, 0809 7000 949 and 0906 2000 949. We'll start to pick your calls after this break. So let's go on a break. When we return, we'll start to pick your calls.
32 FM 94.9.
Sometimes there are truths you know, but you cannot talk about. There are many conversations young people are having in hushed tones and cannot bring to the public. Well, someday you must face the reality of the situation and speak out. We present Loud Whispers. Loud Whispers. A radio drama that takes you on a journey of reality as we explore social issues, reproductive health, and right matters that are often discussed in whispers. Experience 15 minutes of intrigues, humor, and suspense-filled radio drama for 18 weeks.
Join us every Thursday on 32 FM 94.9 from 7:45 p.m. to 8 p.m. from June 2020.
Loud Whispers is proudly brought to you by One Life Initiative with support from Amplify Change.
Stay tuned to 32 FM 94.9.
Okay, welcome back from the break, and of course the lines are open now, so you can put your calls through, and of course as you answer the questions you get to win a gift, because we've got some gifts here, interesting gifts. And the phone lines 0809 7000 949 and 0906 2000 949. Hello.
Hello, ma.
Hi, good evening.
Good evening, ma.
Okay, what's your name?
My name is Adeleke Mercy.
Okay, Adeleke Mercy. And where are you calling from?
From Oyo.
All right. What are the questions you have for us? Do you have any question?
No.
Okay, so we are to ask you a question.
Okay. Sing the radio drama theme song.
Oh, wow, we fast. Oh, wow, we fast. If you are
We are not laughing at you, darling. You tried. In fact, let's clap for her. She has done well. Yes. Okay. So thank you. Just keep listening. We'll tell you what you've won. Okay. So did she win anything?
Yes, she did. She tried.
Okay. Oh, you want to help us to sing the song?
No, they listen to it every day.
No, you asked them to sing the song now, and you were laughing. Okay. So let's make another call. Hello. Uh-oh. I lost that call. All right, don't forget the numbers 0809 7000 949 and 0906 2000 949. Those are the numbers you are to call. And of course, we've got questions for you so you can answer. Hello?
Hello,
good evening.
my name is Marvelous.
Okay, Marvelous. Marvelous, where are you calling from?
From Agbaje.
Agbaje. All right, Marvelous. Are you ready for the questions?
Yeah.
Have you been following?
Yeah.
Okay.
Marvelous, how old are you?
I'm 15.
You're 15, okay. So I'm going to ask you, so what family planning methods were mentioned in the radio drama series?
If that's another question, I don't know that one.
Sorry, you failed it then.
Okay, Marvelous. Maybe you give it another shot. All right. So tell us the answer.
Okay, so some of the family planning methods that were mentioned in the radio drama were implants,
Okay.
IUD,
IUD, implants.
yes, condoms,
Okay.
and pills. That's drugs, contraceptive pills, drugs. Those were some of the family planning methods mentioned.
Okay. Hello. Good evening.
Good evening, ma'am.
Okay. Good evening. Tell us your name.
My name is Francis.
Francis, where are you calling from?
I'm calling from Sango.
All right. Francis is calling from Songo. All right.
Hi, Frances.
Hi.
How old are you, Frances?
I'm 10 years old.
Okay. Which episode of the radio drama was aired today?
I don't listen to go.
Oh, so sorry. So sorry. All right, the 12th episode actually aired today. All right, the 12th episode aired today. All right, this is not Smart Kids, oh. This is not Smart Kids show. All right. All right, so let's see, 09062000 and 0809700949. Hello, good evening.
Hello.
Hello, good evening.
Good evening.
All right, welcome, ma'am. What's your name? Sorry, we didn't get that.
Omolara Adeyemi.
Okay, Omolara Adeyemi. Where are you calling from?
I'm calling from Alakia.
Alakia. All right. Are you ready for the questions?
I'm listening.
Oh,
Hello.
I'm with you. What did you say?
I'm with you.
All right, she's with us. All right.
Hi, Omolara.
Yeah.
How old are you, Omolara?
I'm 15 years old.
Okay, you're 15. Okay. Mention one thing you've learned from the radio drama series.
You said?
Mention one thing you've learned from the radio drama series.
Okay. I learned out of the period, the time of the period.
Sorry, what do you mean by the time of the period?
They said if the woman know the time of the period, you will know the cause.
Okay, so that means you're trying to tell me you know how to track your menstrual period.
You said?
You're telling me you know how to track your menstrual period.
Yes.
Okay.
All right.
That's interesting. Yes, that has helped her to be able to track her menstrual period. All right, that's interesting. So she got a gift, right?
Yeah.
Okay, so interesting. You got a gift. Let's not for her. She got a gift. Okay, that's Omolara Adeyemi from Alakia. You come to the studio tomorrow morning before 12 noon to get your gift. We got a gift for you, okay, from One Life Initiative supported by Amplified Change.
Chai, Kasala don't post. Hey, my own don't meet me today, and I want to make. I wanna, but he say no yawa without rubber. He lie. Me sef come mumu join. We don't even remember Bele at all. Now Bele don't laugh for my domot. Who I won't tell. What I won't tell my mama. Chai, mama get you go kill me today.
Haba, not be only condom you fit use prevent belena, even if yawa boss. Solution fit dey. No go put yourself for gbege. No go wound your body. No go kill yourself. For more information and tori, call 0902 777 0177 quick. Make we yarn with you one-on-one. This message now from One Life Initiative with collaborate from Amplified Change.